Greetings, beloved of God in Delaware. I pray that your Lent is a holy one this year. Today I have a special announcement that I am pleased to make. In 5 weeks, that is on Maundy Thursday, the prohibition on serving wine in the Eucharist will be lifted. That is, in every Episcopal Church, starting Maundy Thursday, whenever the Eucharist is celebrated, wine will be available for any communicant who wants to receive it. And let me be clear, no one has to receive the wine. Before pandemic, this was true. It's certainly true now as pandemic, we pray, is receding. The reception of Holy Communion in one kind, that is bread only, is still as valid and as holy as ever. I'm announcing now a full 5 weeks in advance of the change to give you, the parishes, time to practice, time to rehearse, and get ready to serve the chalice again. Let me take a moment to talk about COVID, because that is, after all, what put us in this remarkable situation of not serving wine for 2 years. And I'm glad to say that the community spread metrics, that is, the measure of the prevalence of COVID in our communities, is low. As we look at the Center for Disease Control's website and follow their metrics, we see that all 3 Delaware counties are well within the low range, that is the safe range. The community spread metrics take into effect the number of new cases in a particular area by county, and then look at, even as cases rise, to see how those cases are affecting hospitals' capacity. And I'm happy to say things look really good here in Delaware. For example, the mask requirement as laid out by the CDC says that anyone who desires to may wear a mask. I often do wear a mask, even in places where it's not required. It's a choice that each of us gets to make. People who have been exposed to COVID or had a positive test or maybe are showing symptoms of COVID or really anything are encouraged, of course, to wear a mask for the good of others. The decision on whether or not a mask is required in worship is up to each parish. It's a decision, as it has been for a while now, of each parish vestry and rector. So let's take a second to talk about the common cup and its safety. For centuries, Christians have drunk the sacred wine from a common cup safely through plague and disease. And even though we cannot find a cure for the common cold and have had it for a very long time among us, we still have safely served the chalice. How is it that I'm confident that the chalice has been safe? True, there hasn't been any long-term, huge scientific studies to prove the safety, but a couple of things point to the reality that the chalice has long been a safe way to serve communion. In 1998, the Centers for Disease Control and Prevention reported that there had never been, up to that time, and this was a little over 20 years ago, there had not been an outbreak of infection related to the communion cup, and that there is a theoretical risk, of course, of transmitting an infectious disease by a common cup, but that risk is so small that it is undetectable. The CDC said that 24 years ago. In the meantime, we still do not have an outbreak reported that is directly attributable to the common cup. Another way of saying this is we've been serving communion in this way for close to 500 years. That means serving communion in both kinds to everybody in the room, not just to clergy. And we've been doing a pretty darn good job of it. The pandemic is, we pray, receding, and we can return to that level of confidence. I think it's important to reflect for a moment that if we did not soon return to the chalice, we would be making a different kind of statement, one that I don't think that we mean. That if we withhold the chalice, even though we're at a time where vaccines are proven to be effective, even at a time when the vaccination rate continues to climb, and even at a time when community metrics improve, if we continue to withhold the chalice where you may be sending the signal that there's something inherently unsafe about it. And that's not provable. In fact, I don't even think it's true. So it's time. So let's talk a little bit about the protocols. What will this look like on a given Sunday? First of all, I think the most important thing for safety, and that's whether it's COVID or any other transmittable disease, that the single most important thing for preventing the transmission of disease is good wiping of the chalice rim and rotating the chalice a quarter turn. Those are as old a practices as I know of. When I was trained as a chalice bearer years and years and years ago, that's exactly how I was trained by the deacon at the church. Wipe the chalice, turn the chalice, and move to the next communicant. This is the single most important thing we can do to prevent any kind of spread. Now, the material of the chalice hasn't been proven to make a big difference. I know that many of us had long thought that silver chalices were safer than earthenware chalices. That can't be proven. But if it is pastorally helpful to continue to use silver, even in penitential seasons for a while, that's fine. But we wouldn't want to unintentionally indicate to people that there's something more dangerous about earthenware if in fact it's not provable. Wiping the chalice and turning it, that's what's important. Eucharistic visitors, Eucharistic ministers, how you return to this ministry is going to matter so very much. The grace and the care with which you take in presenting a chalice with which folks can feel comfortable in is going to make such a huge difference. I thank you for your ministry, and I thank you in advance for taking the time to do this important work well. Now, many people ask about the act of intinction, that is, dipping the wafer into the wine. That too is permissible. The important thing to remember, and important thing to retrain everyone on, is to remember to keep our fingers out of the wine. Whoever does the dipping, whoever does the intincting, that the most important thing is to do so with care and deliberation. So if you're in a parish where self-intinction, that is, intincting your own wafer, is prevalent, then I encourage you, I urge you, I implore you to do so with great care. Dip lightly into the wine. If you have small children who you don't know that they're going to be able to keep their fingers out, then I encourage parents to do that intinction on their behalf. Eucharistic ministers, you're reminded to hold that chalice good and low for someone who is going to intinct so that they can see into the cup and know what they are doing. Sometimes in some parishes there is the practice of intinction where the priest or the Eucharistic minister does that dipping and then places it on the communicant's mouth. Again, practice. Main thing here is to keep the transmission of any kind of illness to a minimum, and that is by the touching of fingers to lips inadvertently. What I would say is, if anyone is feeling sick, if anyone has had a cold, any communicable disease, if you've tested positive for COVID, if you have any sort of symptoms, I would ask that you do what we asked be done before pandemic, and that simply is this: don't take the chalice. Receive communion in bread only. In fact, if you're sick, stay home. That's best for everyone. This is really an important moment. We've been taught over the past 2 years to not only look out for each other, that our decisions around masking matter for each other, but we've also been taught to be wary. We've learned terms like social distancing that have taught us that if we're not careful, others in our community can be a threat to us. And as we come back out of pandemic, we come to unlearn some of those fears. There's no way to remove every single risk from worship, whether from communion or from singing or from shaking hands at the peace. But in each of these areas, we can do things that make our lives safer for all of us. So be smart and stay safe. Blessings to you this Lent. And may the peace of Christ be with you always.